All right, welcome everybody. I'm here with Dr. Miller from New England Neurological Associates here at St. Joseph Hospital. And today we're talking about what NENA, New England Neurological Associates, is now offering at St. Joe's. So thank you, Dr. Miller, for joining us. And we have a handful of questions that we'll be asking him for the next about 15, 20 minutes here.
All right, thank you for having me, Tim.
Absolutely. So let's just start off with kind of a softball question. Tell our audience about yourself, about what you do here, and maybe a little bit about NENA.
Okay. So my name is Robert Miller. I grew up in Denver, Colorado, and I joined NENA in 2016 out of residency. I trained at the University of Pittsburgh Medical Center. My neurosurgery residency was 7 years. And trained in both cranial and spine surgery. The New England Neurological Associates initially is a practice based in the Merrimack Valley in Massachusetts, and as you said, we have begun offering services and care up here in St. Joseph's in Nashua.
Great, thank you very much. So tell us, when people hear neurological services, I think that opens kind of a mix of thoughts of what that really means. Sure. And I'm sure it means different things depending on where you go. So, what is encompassed in the practice of neurosurgery, I should say, and which services will be offered at St. Joe's? Absolutely.
So, the conditions that neurosurgeons treat include both, brain and spine diseases. That kind of ranges everything from tumors, brain tumors, to vascular problems with the brain, bleeding strokes, aneurysms, arteriovenous malformations. Those are all problems, dealing with vasculature. And then, of course, conditions that involve the spine, the spinal cord, and the nerves themselves.
Sure.
So, and by and large, what most folks have problems with that seek our services is, degenerative conditions of the spine, right? Variations of arthritis that we develop as we age, and begin to cause compression or pinch nerve, if you will, on the spine. Additionally, you can have tumors that involve the spine as well. So that kind of is, a rough overview of conditions that neurosurgeons treat. By and large, what we're going to do here at St. Joseph's is help address folks that have conditions with their spine, right? Yep. And again, services range not just from neurosurgery with NENA, but we have folks that encompass other areas of management, such as pain management, as well, and physiatry, areas that are non-surgical management. Sure. In addition to, kind of when you reach that stage, and not everybody does.
Right. So we're not doing brain surgery here at St. Joe's.
Correct. Yeah, the facilities and breadth of expertise expands beyond just neurosurgeons to help care for those patients well.
Understood. Thank you. So, under what context would a patient be referred to you? What does that process look like? Is it typically through a primary care? Is it through another specialty?
It can be. It can be either one. Oftentimes when a patient is referred to me, it comes through either their primary care physician, a physiatrist, or physical medicine and rehabilitation doctor. Also, my orthopedic colleagues will send patients as well when the conditions that they're seeing do involve the spine.
Okay.
Yeah.
Can people come to you directly, or does it really usually have to go through a referral process?
Yeah, I think to utilize everyone's time and resources well, generally a referral to me makes the most sense in terms of making sure that, we're doing the right things for the right reasons. Yeah.
Got it. Great. Thank you. So in terms of your treatment style, I know we often hear about doctors who, treat things more conservatively, more aggressively.
Yeah.
So certainly when it comes to spinal injuries or spinal issues, what would you consider your style?
So, I think everybody that walks in the door and that I sit down and have a conversation with, that treatment plan is individualized to that patient, right? So when a patient comes to see me, part of the consultation is, to get their story, what kind of problems they're having, how long this has been going on for, what treatments they've already tried. A lot of people that have come to see me have done their physical therapy, they've tried injections, other treatment options that frankly just aren't working. And, some scenarios will be that way. And so, whether it's conservative or aggressive, that depends on how you think about the disease process itself. I am aggressive in surgical management when there's evidence that a patient has nerve damage, right? That's not somebody that I would wait to, put through other treatment options, because the one that is going to address their problem successfully with the highest chance of long-term success is going to be surgical. But when that's not the case, when it's mainly pain predominant or numbness predominant, right? We're talking about things like pinched nerves, for example.
Sure.
Yeah, we're going to do the conservative measures first. We're going to do the physical therapy. We're going to do the injections, medications before we get to surgical intervention. And there are times when the surgical intervention, the benefits do not outweigh the risks, and those are patients when I say, all right, we need to think about other treatment options. So it's individualized for the patient based on their story, based on their imaging, and what's been done so far.
Great, thank you. So let's assume a patient's been referred to you. What does that first appointment generally look like?
Yeah. As I was saying a few minutes ago, somebody comes into my office for a consultation with me. My goal is to establish a relationship, an understanding of what their problems are, what their imaging shows, getting a detailed examination, and coming up with a treatment plan and expectations and what our goals of care are going to be. And sometimes, again, that is referral to other specialists to help participate in that care. My philosophy on management of spinal conditions, particularly degenerative ones, is that oftentimes this is a team approach. I incorporate a lot of physical therapy, both before and after surgery, and pain management doctors to help me kind of localize problems. Sometimes an injection can be both diagnostic, meaning it helps me determine that, yes, that's where the problem is coming from, and therapeutic. Hey, maybe we're going to get better for a little while. Sometimes that's long-standing, and sometimes it isn't.
Sure.
And it depends on the degree of how much pressure is on the nerves.
Great, thank you. Another question that I shouldn't say question, really a comment that we hear from patients and really just people in our community is that you have to go to Boston for great care, for especially when people start thinking about things like neurosurgery and some of those I think scarier topics.
Sure.
And what are your thoughts on the level of service we are now providing here versus what you would receive by going to one of the big Boston hospitals?
Sure. So, my take on this is that, the large tertiary care centers and facilities are really good in things where you've got uncommon problems or uncommon conditions or rare conditions, right? Because those are the people that are going to see the most of those things. Routine, and again, it's hard to call it routine, but my job on a daily basis is to operate on the brain and spine. So, conditions that are frequently seen and frequently treated, such as, pinched nerves in the neck and in the low back.
Yep.
Those are treatments that we can provide close to home. So folks don't have to make that commute, and we can arrange, if there's additional care that needs to take place, we can arrange that regionally to help keep patients close to home.
Great, thank you. And you may have mentioned this at the beginning, but it's not just you that's working here as well.
Correct.
We have a couple other providers that are here and at St. Joe's as well, correct?
Yes. So, the team of neurosurgeons is myself, Dr. Bruce Cook, Dr. Henry T., and Dr. Anna Terry. The four of us are going to provide neurosurgical services here. And we have pain management, psychiatry, and hopefully neurology, general neurology soon as well.
That's great. So we really have a great team and a lot of options and a lot of resources should someone come in even with a maybe atypical concern.
Yep.
And so you have folks you can kind of bounce off of. And
Exactly. And, having colleagues to help look at things is great. We give our own internal second opinions, right?
Right.
We can help look at things, some of us have seen maybe more than others. And in that regard, that is similar to what you find at the Boston teaching hospitals when you've got, multiple specialists looking at a condition as well.
Yeah. So just to wrap things up, is there anything else you'd like to share with our audience, our patients, our community, about NENA, about yourself?
Yeah, I'm excited for the opportunity to provide care in this area. My wife's from New Hampshire, and I really enjoy the area and the people around. So I'm looking forward to helping folks out with these conditions.
That's great. Thanks so much, Dr. Miller. We really appreciate you having you with us today. And I think we're here at St. Joe's. We're very excited to see all the services you can provide our patients, and we look forward to moving forward.
All right, very good. Thank you very much.
Great.